broken the system. So I think there is some question online. I think I try to pull up, from the audience. Just a second here.
Mm-hmm.
It's on the Google Plus pages. Just a second. Apologize. I try to pull it up. Yeah, I did, by the way, I just put on your paper link to the YouTube channel so people can refer that reference. That's good. And I think the other points I want to learn from you is this you can use a user case for the delivery unit. This can be applicable for so many other units, right? EDs, OR, ICU. Do you have some experience?
Oh, absolutely. I mean, we here at the Children's Hospital, we are deploying discrete event simulation for our operating room core, for our cardiac surgery and cardiac catheter areas, including the CICU. And I'm planning on doing work in the emergency room starting in the late fall. Of course, I've treated the emergency departments at the St. Louis Veterans Administration and at Brown's Rhode Island Hospital. So it's applicable to really many different facilities.
Okay, cool. There's a question on the web, asking what particular software you are using, and is there any specific software you are using for your own project,
So there's a number of different discrete event simulation softwares, and I do not professionally endorse any particular one. This model was developed using MedModel Professional 8.6, I believe. I have also used AnyLogic, which is a multidisciplinary suite. There's also Arena, of course, Simulate, FlexSim. There's a number of different softwares, and frequently each one will have their own particular value, and it's probably worth exploring which one would be best for your own environment. I have used MedModel a great deal in my career, and I like it. Like I said, I don't specifically endorse that product. But it should be noted, too, that these software licenses can be expensive. They may run for an academic license where you're not planning on using them operationally. They may be, $1,000 or $2 for a professional license where you're going to develop and deploy and maybe even profit off of the results. These software licenses can be in the tens of thousands of dollars. So it does represent an investment. But like I said before, I think it's an investment that will pay you back much more. For example, one of the issues that we want to look at is where patients recover, whether they recover on a post-surgical ward after surgery, whether they recover on a post-surgical ward, or whether if that ward is full, they recover elsewhere in the hospital. It's well known that patients suffer fewer complications and have shorter lengths of stay if they stay on the surgical ward rather than elsewhere. And so an intervention which improves the likelihood that patients post-surgical floor may pay back immediately in terms of the lack of a diminished number of hospital-acquired conditions that may not be reimbursed by insurance, et cetera. So it is an investment up front to get a software license and to hire a developer, but it should pay you back fairly rapidly.
So basically, you are saying, this software need to special training in order to really get the full potential of that. It takes some time.
Absolutely.
Okay.
Absolutely. So I have been working with discrete event simulation now for approximately 17 years. The software companies that write and sell discrete event simulation software are often very fond of saying that it's very easy and you can build models very rapidly with very little training. I do not endorse that statement. Simple models might be easy to create, but useful models are rarely simple. And hiring someone with the expertise and the ability to truly validate a model and understand what the model is saying and what it's doing, I think is crucial to deploying this in an effective way.
Okay, so that's great. So basically, you said the partnership with professionals like you is very critical to make a successful project down the road.
I believe so. Yes.
Yeah. Okay, I think time is past. 4 o'clock. 5% your time. I think we will have another session actually in the coming Society Simulation Healthcare Conference in New Orleans in this 2015 January. We have a session. Yeah, we have a session submitted. So if people want to learn more, I think we'll be happy to have a discussion with more colleagues, sharing our experiences. And again, thank you, Dr. Day, for your presentation. We're looking forward to more learning from your group.
Thank you very much.
Thank you.